Thank you everyone for being here and thank you for the introduction. I'm Karen, I'm a nurse specialist at Royal Marsden Hospital, and I wanted to just bring to you just a little flavour of what we're doing at the Royal Marsden. It's not a publicity campaign, or it may sound a little bit like that, so I don't even shamelessly apologise. But just to say, this is what we're doing at the Royal Marsden. And for us, I was quite pleased with my title. Aftercare is not an afterthought, and it seemed to fit in well with the theme of what we're doing. When I started at the Royal Marsden 13 years ago, there were just two of us. We were 1.5 full-time equivalents, so 2 part-time nurses, and we covered everything from the age of 1 up to the age of 25, and that was all the benign brain tumours, that phrase, as we said earlier, benign or malignant, the low grades or the high grades. All of our patients had individual needs and all had competing needs between themselves, and also with the patients that had finished treatment who are now coming back to the surveillance clinics. In the 13 years that I've been there, we've undergone a huge change, and we've now got an additional 0.8 nurse specialists. So very fortunately for me, we've now set up an aftercare nurse specialist service, which is my new role, which started officially last year. What always happened was that our patients would stay under the nurse specialist for neuro-oncology and their neuro-oncologist until 5 years off treatment. And then at 5 years off treatment, they would move into the late effects team. What we knew was that our families would often ring with problems, but they would always apologise. They would always say they were really sorry to bother us. They knew how busy we were. They always spoke with great gratitude for any help that was given. And what we've appreciated over the last few years, in the more recent years, is that this isn't good enough. This isn't what we want for our families that are off treatment. And we want them to feel just as important as those that are going through the acute treatment. So now the aftercare nurse specialist works alongside both the acute nurse specialist and the late effects nurse specialist. And there's a sort of a bridging thing going on. Sometimes it's a tug of war, but not often because we're all very friendly. And the reason we're doing this is because we know that we've got increasingly complex protocols and treatment provision. It's getting much more technical than it ever used to be. Somebody spoke earlier about how in the bad old days, when I first started oncology nursing, you didn't see the neuro patients on the board. They were either having surgery alone or radiotherapy, and they weren't having chemotherapy and they weren't in the units. So we know that there's a huge portion of patients now getting treatment that weren't getting as much treatment before. And we know we've got more survivors with increased complex needs. You know, we've hammered that home today, that we know that all of our young people and families are surviving with complex needs. So because of our increased demand for rehabilitation and support services, we've looked at what we're doing. We can also see we've got very patchy, our geography is huge. We cover from the South Thames down to Brighton and all the way across to Margate. And some of our families, if they were any further away, they would be speaking French because they are right on that English Channel coast. And what we know is that some of those local services are excellent. Some of them have got services that are keyed into neuro rehab. There are services that are somewhat aware, and there are services who actually have no clue what to do with a patient who's had a brain tumour because they've not experienced this before, because they consider that these aren't acute changes and there's nothing that they can really offer. So we're always liaising with local teams to find out what they can do and what we can persuade them to do. And what we know is that we know our families need advocacy support. So that's a big part of this job, is to make sure that the families get an opportunity for someone to campaign with them and for them. And our focus for our patients now on treatment is not just survival, it is the quality of life. So the theory behind it, a bit preaching to the converted, because you all know this, we know that families at the end of treatment face an absolute cliff edge. They have the most vulnerable time when they're just needing the reassurance and support of those around them that have been there for the last 6 months or year of their treatment. Suddenly they're not coming every week for bloods, they're not coming regularly for investigations or admissions, they're having 3 monthly scans, they're having a 3 monthly clinic, and that just doesn't feel enough. They might be glad to get rid of us, but at the same time, they're also really vulnerable and really afraid. There's a complete lack of control. They don't, there's not a control of what can happen next. There's just that uncertainty of we were having treatment, we felt secure while we were having the chemotherapy and the radiotherapy, and suddenly now that's stopped. So is it going to come back now, and when? Managing the consequences, it's no good saying that this patient has finished treatment, so now they can recover. We know it takes months to years to recover physically from just the chemotherapy and the experience alone. And we know that a lot of these families never get that same level of, or that child never gets that same level of function, either physically or emotionally. And as I said, we're separating them from all the support networks. Everybody thinks they're fine. They're going back to school. School thinks they're fine because they're back at school. And it's far from that. So I've just put the reference there, Twiving in 2023. And as nurses, we see the effects on physical and emotionally and on their well-being. And we see families who are very cracking through treatment, sometimes with a lot of reassurance needs. But then when they hit that end of treatment, everyone's telling them, are you having a party? Are you ringing the bell? Are you ringing the bell? It's a huge celebration. And they're just not in that place. There's not a field for all of them that they need to have a party. And it feels a very vulnerable, scary time. And the late effects team will tell us that they're so frustrated because they see these families at 5 years and it's too little too late. Some of the bad habits, some of the negative behaviours and negative thought processes have already established, and you're trying to undo some of that and get them back into a position where they're looking forward. So what we wanted to do was recognise these effects, and also that nurse specialist who is dealing with the demands of the medical needs, bless you, the needs for investigations to be set up, the needs for Lord knows how many assessment forms and holistic needs assessments that we try and do. There's a lot of competing demands for nurse specialist time. What we really want to do is give the best we can to our families, so we split the posts. We now have 2 nurse specialists part-time that are looking after just patients on treatment, and myself at point 8, I'm just looking after those off treatment. And what that means for us, and all of this is based on an innovation that happened a couple of years ago, and I had to name check Jo Stone, our nurse practitioner, who was in one of the other studies with the learning curve. This was her idea to create a back on track clinic. So she got funding and we set up a pilot study with an occupational therapist to invite families at 1 year of treatment to come back, do a questionnaire based on their needs and the needs of their child, and that could encompass everything to do with the physical, the mental health, the social, the educational, you name it. It asks parents and young people to complete how things are for them. And we then run the Back on Track clinic according to what they tell us. We don't go in with an agenda other than if they want to go through their treatment summary, that's a good opportunity to do that and give it to them at the time. But also, how many families will remember what they said, or what was said in the consent discussion? I've already spoken to Laura this afternoon about informed consent. When we ask families to consent for treatment, do they know what they're signing up for? The answer to that is, as we know, is very unclear. So we go through that treatment summary. We go through the things that they want to tell us about. And then the occupational therapist, the psychologist, and myself will then create an action plan to take forward. That Back on Track clinic was such a success that now continues as a rolling programme. And then with the aftercare nurse specialist post, we've now put in a end of treatment clinic review at the end of treatment. So within the first month of finishing treatment, they'll have a telephone or a virtual meeting to go through anything practical. It could be line removal, going back to school, when to go back into hospital for infections, anything that they have questions about. We do a 6-month treatment summary. If we possibly can, we're trying to bring that down to 6 months now, so we can give that to them at their 6-month clinic review and go through any discussions then, and then it makes that a little bit more easier at the 1 year clinic. We've got a 1 year Back on Track clinic, and we've got dedicated CNS support. So when the families ring, there's no need to apologise anymore. Please keep me busy, because this is what keeps me busy. With the things that we've got in grey in the circles there are things that we're working on for this year. We're looking at parent feedback audit, which we've just completed, and just number crunching. We're looking at a frequently asked questions video. We've got one for patients that are starting treatment, and we want one for families that are finishing treatment. We're trying to organise a parent meet-up, and that's a lot harder than any of us ever thought that would be. I don't know. You think that it's wanted, but it doesn't necessarily mean that people will come. And just one little thing, we just number crunched the Back on Track clinic for last year, and we successfully completed 20 out of 25 possible clinic patients. One declined and didn't want to take part, which is absolutely fine, it's voluntary. One said yes, but then didn't turn up on the day, which is unusual. And what I should say is we do try and do this on a day that they're in the hospital anyway, so we try and make it worth their while. There were 32 themes of discussions identified, anything from body image, fertility, growth, anything that they wanted to raise. 15 referrals came out of those 20 clinic appointments, and we had 6 liaison contacts with schools. So it's very much based on what that family needs. And just to finish off, going forward, as some of you know, we're moving to the Evelina Hospital next year, so we're very much hopeful that in that move we can increase our engagement with things like the sleep clinic. I've already taken I need to speak to you afterwards, and with the neuro rehab services, because there's always room for improvement. Thank you very much, and any questions, happy to answer.